In this video, I'm going to show you specific exercises you can perform to improve the mobility in your knee as well as your hip. And then we're going to move on and do strengthening exercises to strengthen your knee and hip. Now, I'm making this video for a very special patient of mine who just got released from the rehab hospital. All right, man, you know who you are. I hope you enjoy. So, first off, what we're going to do is we're going to lie down on our back. Now let's say that the left leg is the leg that needs to be stretched, okay? So we're going to bend and hold for 5 seconds and bring it back down. And as you continue to do this more and more, you'll be able to bring it further back. Now after you've done that a few times, you want to get an extra pull to it. And the best way to do that is to use a strap. Now, if you don't have a strap, that's okay. You can take a towel, roll it up, and strap it around your foot. If you have difficulty bending your knee too much, you gotta lean forward, stretch those hamstrings. Put it on your foot, and then you're going to lightly pull until you feel a good stretch in your knee. Hold that for about 10 to 20 seconds. And then after you've held it, you bring it back down, relax, and do it again. When you hold that for about 10 to 20 seconds, do it 5 to 10 times, depending on how much of a stretch you really want. What you want to do next is wrap this around your foot and lie back down, and then you bring your strap up and you stretch the hamstring. All right, I'm going to leave a link below. If you choose to purchase a strap, that would be great. If you want to get a towel, roll it up, or a sheet, roll it up, that would be fine too. So you do about 10 of these for a 10 to 20 second hold, okay? Then we're ready to move on. Next exercise, you want to take your hands, put them on each side of your knee, and then kind of glide it back and forth like that. That's going to stretch out the knee. It's going to mobilize the knee. And then you want to come down at the bottom of the kneecap and push down, and the top and push down. So it's like back and forth motion there. Okay, side to side and back and forth, up and down. And do this for about, let's say 30 seconds each direction. Now that we've stretched it out a bit, let's do some strengthening exercises to help strengthen your knee as well as the hip. So down into the mat or the bed, wherever you're lying, and then bring your toes back as well. You get that really good muscle contraction. I'm going to show you my legs a bit more so you can see what I'm doing, and then relax. And again, muscle contraction, hold. You want to hold for about 10 seconds. And perform this exercise 10 times. Once you're done, let's move on. The next exercise you want to perform is called hip abduction, okay? It strengthens the outer hip muscles. So, I'm going to just get like this instead of lying down all the way. You'll bring your leg out to the side, slide it, and back. And do this about 3 sets of 10, okay? The next one, we bend one knee, keep the other leg straight, add that quad set, and then raise it up and down, okay? So straight leg raise. Now, it'll be challenging, okay? You're probably gonna have your leg like this, you're gonna be struggling, trying to bring it up. And you just wanna be aware while you're doing that, you're strengthening this hip, but you're putting a lot of stress on the knee. So what you should do is take a towel roll or your strap, wrap it around your foot, and keep your leg totally straight, lock it out, and assist it up. Because that's going to then keep your leg straight, strengthening the muscles, and raising it up and down in a safe fashion. Again, it's probably easier to lock down for this one. So you can just come up and down. You want to do 3 sets of 10. and then move on. Next exercise, take a pillow, okay? You bend your knee as far as you can because I know it's going to be hard to get that knee bent, okay? But you bend it as far as you can, then bring the other one equal to the injured leg. Put a pillow in between your knees and you squeeze it and hold for a few seconds and then release. Squeeze, release. Squeeze and release. And you want to perform this for 3 sets of 10. And when you're done with this, you move on to the next one. Last exercise, what you want to do is you want to bend your strong leg so you have your foot flat on the mat, the table, the bed, wherever you're lying down. Then you want to bend your injured leg as far as you can. Let's say you can only get to about there. So you have your heel on the ground and you want to do a bridge. So you're going to put most of your weight on this leg while adding some to this. You're going to lift your bottom up and down. And you're going to keep doing this for 3 sets of 10. Now, as your injured leg gets more flexible throughout the days and weeks through the stretching you've just done, you're going to be able to bend it a bit more. So eventually you'll get that leg equal to the opposite side so you could do a full bridge. Now you're weight bearing, you're strengthening the hamstrings and the glutes, you're getting a good workout. You want to do 3 sets of 10 of these. Now keep up with these exercises and you'll notice your mobility and your strength improving in your knee as well as your hip. You'll be walking in no time. I wish you the best. Comment below if you found this video useful, and in a few months you'll be doing this with your knee again. All right, take care.